Possibly the most frequently asked question about CASPer is, how is CASPer scored? While this isn't a secret per se, it's not something schools or administrators will actively provide you with. While knowing how the scoring system works is important, it's not the same, and it's not even as important as knowing what the assessors are looking for when scoring the questions. So in today's video, I'll cover an intro into CASPer, tell you how the CASPer test is scored, tell you what the evaluators are looking for, and I'll tell you about red flag answers so you're sure to avoid big mistakes when giving your CASPer responses. A quick intro before we begin. Hi, I'm Nadine Evans, an Admissions Associate at BeMo Academic Consulting. Make sure you subscribe on whatever social media channel you're watching this from now so you don't miss any of our upcoming videos. If you'd like us to help you prepare for your CASPer tests, go to BeMoCASPer.com to schedule your free initial consultation. As a quick tip, if you'd like, feel free to use the time codes in the description of this video to navigate to specific sections of the video that you're interested in. So what is CASPer and how does it work? At its core, and just like the MMI, the CASPer test is an online situational judgment test claimed to evaluate an applicant's qualitative or soft skills such as professionalism, maturity, and communication. Often, CASPer is used as an intermediary or additional step between application and later in-person interviews, allowing the admissions committee to determine a candidate's likely suitability for the course of study and profession prior to extending an invitation to meet in person. As many schools and programs now engage in holistic review, that is, review of a candidate's personal, professional, and scholastic competencies, evaluations like the CASPer test are intended to allow students to provide crucial insights into their own priorities, values, and interpersonal skills so that these can be considered alongside their academic achievements. In fact, CASPer has been shown to count for up to 1/3 of an applicant's pre-interview score, meaning that effective CASPer test prep is absolutely crucial for performing well and getting an interview. In taking the CASPer test, you will be presented with 12 prompts, one at a time, and you will have to respond to a set of 3 questions related to each prompt. The prompts are presented in either video or text format and are often based on thought-provoking, real-life situations, professional ethics, and hot topics in the field, and the associated questions offer you the opportunity to demonstrate key qualities sought in professionals in your discipline. Note that while the CASPer test is intended to gauge certain characteristics in evaluating applicants in specific disciplines, the prompts themselves are not necessarily based exclusively on information in those disciplines. Rather, the prompts and questions could be related to any real-life activity, such as incidents witnessed or experienced in everyday life. For example, a friend about to drive while intoxicated, a rude customer in a store, current issues or events in the headlines. Even if you do get a question related to your field, it is understood that you yourself are not yet a practicing professional, so specialized or advanced knowledge of the field are not required. They simply want to see your priorities, your initial reactions, and tendencies in responding to these challenging scenarios. Knowing how the scoring system works shouldn't change your approach to the questions or how you construct your responses. So let's get right into it. How is CASPer scored? As the assessors analyze your responses, they will be applying the CASPer marking criteria to each answer. Responses are analyzed to see if they reflect the qualities of a good, moral professional. There are often a few reasonable responses to a given scenario. No answer is truly wrong either. However, there are responses that either do not reflect good personal or professional qualities or are inappropriate. If you wouldn't share your answer in a face-to-face interview, you're on the wrong track with your response. If you can't imagine a professional saying it, then don't say it. Answers that are poorly composed or demonstrate limited understanding and reasoning will also score poorly. Answers that are unprofessional can result in a red flag for an entire test. So the CASPer test is marked on a numerical score that reflects how well your responses either meet or does not meet or exceeds the assessor's expectations. Each station has 3 questions, and it's rated on a scale of 9. 1 signifies an unsatisfactory response, and 9 signifies a superb or superior one. Simply answering the questions is likely enough to receive an average score. However, average scores for all of your responses are not enough to succeed. To exceed expectations, you will have to provide excellent reasoning for how and why you formulated your decision through an effective communication style. It's not impossible to score well, and this can be done with preparation and practice. So who are the CASPer Assessors and how are they trained? Each CASPer Assessor is given an online orientation and training session on the logistical aspects of marking CASPer tests. So for example, how to use the secure login system, how to ensure they have appropriate software for running the clips, etc. And the criteria that they must apply to these responses when grading it. This is the aspect of the test that is claimed to minimize subjective judgment in favor of objective assessment criteria. Notice that I'm saying minimize, not remove. Tests with written answers marked by humans, even ones who are experts in the field, will never be 100% objective. The assessors for the test are individuals from all walks of life. So this includes medical professionals, medical students, residents, members of the public, undergraduate students, or anyone provided with a registration code, which allows them to go through the online training process to become a CASPer Assessor. The online training program gives an overview of the test and how it should be scored. Recall that each assessor only sees one scenario for each applicant, and they are not aware of the applicant's personal identifiers. Thus, each applicant's CASPer test will be seen by 12 distinct assessors, helping the claimed increase in the inter-observer reliability of the test. The assessors are given general information about the concepts important to each scenario and major ideas that should be discussed, but they are not provided with any sort of answer key. Okay, so let's go through a sample question with a breakdown of how an assessor would score you and what they'll be looking for in your response. Application of criteria will vary from question to question, and you may be given a scenario centered around informed consent, but then you could be asked a question on patient autonomy, such as this following example I want to go through. So this question says, you are a surgical resident in an outpatient clinic seeing a patient who has been diagnosed with ovarian cancer that requires surgical intervention. You are discussing the details of the surgery and explain that both the open and laparoscopic oophorectomy are possibilities in her case. 1. How would you ensure any consent this patient provides for surgery is informed? After your discussion, the patient expresses that she does not wish to undergo surgery, stating that she would like to give chemotherapy a chance first. How do you respond to this decision? First, note that advanced technical knowledge is irrelevant, and if you see a technical term in CASPer, it is just meant to shake you up a bit and stress you out. As you can see, this sample question encompasses numerous areas and deals with several ethical concepts. While the first question specifically asks about informed consent, the second then asks a dimension of patient autonomy and could even be argued to branch into evidence-based medicine. From an assessor's point of view, the more dimensions of the question you can demonstrate that you have recognized and considered, the better the grade you will receive. In this example, you would need to appreciate what important aspects of the patient encounter contribute to informed consent. So for example, proposed procedure, details, possible alternatives, risks and complications, consequences of doing nothing, etc. And recognizing that, provided that the patient has a capacity to make her own decision about their healthcare, that making the decision to decline surgery, although potentially inadvisable within the context of their illness, is the patient's inalienable right as part of their autonomy. And remember, the grading of CASPer responses is done using a numerical Likert type scale. The scale runs from 1 to 9, and as I mentioned before, 1 is unsatisfactory and 9 is superb. Now let's talk about content evaluation. So what you say and how you say it, and how that can help determine your score. So let's explore some of the things the CASPer test raters are looking for in reviewing your answers, so you can assure that you know how to prepare for CASPer effectively. Each response to the prompt, evaluators are trained to mark based on the following. How many of the key ideas in the prompt you have identified, whether you have isolated the key pressing issue and addressed this maturely and professionally, whether you are objective, non-judgmental, professional, mindful, whether you've carried over any assumptions from the prompt, or better, whether you have questioned such assumptions and applied critical thinking skills in exploring the scenario, your ability to avoid a biased, one-sided response and to consider multiple perspectives, whether you demonstrate consistent moral and ethical values, and whether your adherence to such values is maintained under pressure. your ability to provide clear, concise answers, demonstrating effective communication skills. Whether your response feels scripted, insincere, or canned, or whether it's an authentic, genuine response. Whether you pursue positive resolution to conflict, or whether you back away from conflict or act like a bystander, rather than an upstander, one who defends the rights of others and acts in the interest of vulnerable parties. And a response that manages to do all of these things will likely receive strong marks in the evaluation. So this is when we get a little bit of a panic from our students because they understand all the things they need to do, and then it kind of dawns on them. It's like, wait, I have to do all of that in only 5 minutes. So how on earth are you supposed to put together such robust answers in 3 open-ended questions with that level of depth in 5 tiny, precious minutes? If you've been a student for a while and have taken many tests, it would seem logical that with each station having 3 questions and a total of 9 possible points for the station, each of those 3 questions would be worth 3 points. However, it must be emphasized that this is not how the CASPer test is scored. Rather, each section is evaluated as a whole out of 9, regardless of how many questions are answered. That's to say, even if you leave a question completely blank, you're not necessarily losing points. It's absolutely possible to receive an excellent score even if you only answered 2 questions, let's say. So just to drive that home, you will not necessarily receive a lower score if you have not been able to answer all 3 questions. Even if you run out of time and the test automatically advances to the next question before you've completed the sentence that you're typing, there's also no need to panic. The CASPer test evaluators know that you are pressed for time and are trained not to penalize you for such things. Assessors are not required to comment on the score that they give, and they don't need to provide any feedback to justify the score. However, they do have the option to flag a particular answer or indicate the possibility of technical glitches that may have led to poor performance at a given station. This will act to highlight the candidate's response when university admission staff review their results. What type of a CASPer response constitutes a red flag? An assessor will flag an answer for the following reason. The response given indicates a dangerous, unethical, unprofessional, or potentially harmful approach to the scenario that displays a clear deficiency in the candidate's ability to appreciate the complex ethical issues raised. So in the event that a response is flagged, the assessor is then obligated to comment on why they flagged the answer. The other reason assessors must elaborate on their flagging of an answer is to justify their reasons for flagging it. This acts as something of a fail-safe for a candidate's application process. The red flagged response and the assessor's comments will be reviewed by an admissions officer or committee. If it is felt that the assessor was excessively harsh in their judgment of the response, and provided that the remainder of the candidate's response is scored well, this red flag can be overlooked within the context of the candidate's overall application. However, multiple red flags on a candidate's test score are likely to result in rejection of the application. You may be asking yourself, what happens if my test is marked by an assessor with excessively high standards? Well, this is unlikely because, importantly, each scenario is marked by a different assessor, making it very unlikely that you ended up with 12 assessors that were all difficult graders. Furthermore, given the instruction CASPer assessors receive with regards to objective marking criteria, the marking system is set up to account for the possibility that some assessors have more critical approaches than others. When marking CASPer, an assessor will usually be given a series of candidates' responses to the same scenario and questions. The advantage in doing this is twofold. The assessor can apply the same criteria to multiple applicants' responses rather than having to shift focus between subject matter every time, and the applicants have a different assessor marking each question rather than one continuously harsh or lenient assessor for their whole test. This is fairer and gives a more accurate representation of the candidate's interpersonal skills and ability to respond to the challenging scenarios CASPer presents. So hopefully you have a better idea of how the CASPer test is scored and you know what the CASPer assessors will be looking for. This wraps up another one of our videos, so please subscribe, like, and leave a comment if you have any questions that I didn't cover in today's video. Do you have an upcoming CASPer test? Let me know in the comment section. If you'd like us to help you prepare for your CASPer test, go to BeMoCasper.com to schedule your free initial consultation. Thanks for watching. Bye for now.